Hello people. Today's topic is coronary circulation. The heart's supply and drainage systems are referred to as coronary circulation. The name coronary means crown. The coronary vessels are of two types, the coronary artery and coronary veins. The coronary arteries supply the heart muscles with oxygen and nutrients during heart diastole. The coronary veins, on the other hand, remove carbon dioxide and other waste products during systole. The coronary arteries are of two branches, the left coronary artery, LCA, and the right coronary artery, RCA. These two coronary arteries arise from the left and right aortic sinuses. So, what are aortic sinuses? The aortic sinuses are small pockets structured behind the left and right flaps of the aortic valve. When the heart is relaxed, blood enters the coronary arteries because the backflow of blood fills these valve spaces. Let us look at the left coronary artery, LCA, first. It gives out two branches initially. The first branch descends on the anterior aspect of the heart. Hence the name of this branch is the left anterior descending artery, or LAD. The LAD supplies a major portion of the left ventricle, a small portion of the right ventricle, and anterior 2/3 of the interventricular septum. The left coronary artery also gives off a vessel that makes a curved turn to the posterior aspect of the heart. Because it makes a curved turn, it is called the left circumflex artery. The left circumflex artery supplies the left atrium and a small part of the left ventricle. The left coronary artery also gives out the branch which travels at the left border of the heart and hence is named the left marginal artery. The left marginal artery supplies a small portion of the left ventricle at the left margin of the heart. Now, we will look at the right coronary artery, or RCA. The RCA descends and gives out a branch that travels at the right margin of the heart and hence is called the right marginal artery, RMA. RMA supplies the right ventricle and the apex of the heart. After giving out the right marginal artery, the right coronary artery makes a turn and goes posteriorly, and then it descends, giving the name posterior descending artery, PDA. The PDA supplies the right and left ventricle and also the posterior 1/3 of the interventricular septum. The RCA also supplies the SA node and the AV node of the heart. Now, we will look at the venous drainage of the heart. The veins of the heart will drain into a structure called as coronary sinus. The coronary sinus is located posterior to the heart and it drains directly into the right atrium. Additionally, there are tiny cardiac veins that enter the right atrium directly. The greatest tributary of the coronary sinus is the great cardiac vein, also known as the anterior interventricular vein, which drains the area supplied by the left coronary arteries. Other than that, the middle cardiac vein and the small cardiac vein cooperate and drain the right atrium, the right ventricle, the nodes, and the posterior interventricular septum. The knowledge of the anatomy of coronary arteries and the regions that they supply are crucial clinically when you are treating a patient with coronary disease. These are some questions that can test your remembrance of the topic. Pause this video and try to answer them. Answers are posted in the pinned comments below. That's all guys regarding the coronary vessels. If you find value in this video, please like, comment, and subscribe. If you have any biology topics that need discussion, send them via the Google form that I have linked below.